The clinical importance of nutrient combining in modern day practice is monumental in optimising clinical outcomes. The blend of magnesium, taurine, zinc citrate, activated B vitamins and buffered vitamin C is one such combination. This combination of nutrients has synergistic effects on multiple body systems, including the nervous system, cardiovascular system, renal, hepatic and musculoskeletal body systems. Taurine and magnesium in particular are the two most essential nutrients across this body system crosstalk, and in combination have been shown to support mood and the stress response, improve insulin resistance, prevent arrhythmias, lower blood pressure and stabilise platelets. As practitioners, we are aware of the importance of nutrient compatibility and synergy, and the impact synergistic blends can have in regulating concomitant symptoms and health concerns. This is often characterised in patients who require support in maintaining healthy metabolic, cardiovascular, renal and musculoskeletal function, or may need support during times of stress. Magnesium, taurine, activated B vitamins, buffered vitamin C and zinc citrate are the ideal nutrients to support systemic health states which can involve numerous body systems. In modern day practice, the need to support several body systems is often vital to optimise patient health that has been compromised, often due to nutrient depletion, genetic predisposition, environmental and lifestyle factors. Let's take a closer look at how these nutrients influence body system crosstalk. One of the key clinical applications of these nutrients is the nervous system, particularly patients undergoing times of stress. Emotional and physical stress has become a critical public healthcare concern, impacting differently on the lives of Australians. A recent survey reported that more than 80% of working women felt their current stress level was having an impact on their physical health. Alongside this, 1 in 8 Australians report being affected by severe to extremely severe anxiety symptoms. In the nervous system, zinc and magnesium play a major role in the HPA axis and the monoaminergic neurotransmitter system. Regulation of the GABAergic and glutaminergic systems are of utmost importance when managing anxiety, nervous tension, and a healthy stress response, which require these nutrients to maintain healthy function. Taurine is undoubtedly a vital amino acid within the central nervous system, as it has been shown to support and regulate the balance between glutaminergic and GABAergic neurotransmission. Taurine is a GABA agonist and regulates neurotransmission by elevating GABAergic neurotransmission by binding of the GABA receptor. Modulation of glycine receptors is also a vital action of taurine in the nervous system. The main action of magnesium in the nervous system is to prevent excessive calcium-induced intraneuronal excitation, which ultimately causes depression and anxiety-like behaviours. The excessive movement of calcium through the synapses causes damage to neurons, potentiating disruption of behaviour, memory and mood. Revolutionary research has shown evidence that patients with depression or related mental disorders should acquire more than 600 milligrams of magnesium per day to assist in the handling of stress. Alongside this monumental research, a randomised clinical trial recently asserted that a daily dose of vitamin C at 1000 milligrams reduced moderate anxiety levels in type 2 diabetics through reducing oxidative damage. Combining these nutrients is also ideal in clinical practice when treating conditions of the cardiovascular system, particularly cases involving blood pressure regulation and dyslipidemia. In hypertensive states, vitamin C has a significant mechanistic role in reducing systolic and diastolic blood pressure by increasing the bioactivity of nitric oxide, a powerful vasodilator, thus improving endothelial function of brachial and coronary arteries. Cardiac muscle contains high concentrations of taurine with effects that radiate throughout the entire cardiovascular system. The cardiovascular regulatory role of taurine involves platelet activation, aggregation and adhesion. Taurine also supports bile acid conjugation, cholesterol degradation and elimination via the liver, enhancing LDL uptake and stimulating the binding of LDL receptors. A recent and highly valuable systematic review conducted on taurine collaborated some dose-dependent studies on a daily 6 gram and 3 gram regimen. 6 grams for up to 4 weeks improved cardiac function, increased VLDLs, and decreased total serum cholesterol and LDLs. The same review found 3 grams daily decreased left ventricular and end diastolic volume, triglycerides and blood pressure overall. Downregulation of the renal sympathetic nervous system reduces the production of adrenaline and noradrenaline, which is the major mechanism involved in supporting healthy blood pressure. Adrenaline increases heart rate and noradrenaline causes vasoconstriction. Taurine reduces blood pressure by modulating calcium homeostasis, regulating osmoregulation, and potentiating vasorelaxant properties. A 6-gram daily dose of taurine over a 7-day period was found to significantly reduce systolic and diastolic blood pressure when compared to a placebo. In the renal system, taurine governs glomerular filtration rate, renal blood flow, iron reabsorption, osmoregulation, and the composition and secretion of urine. Low serum vitamin C has also been shown in the research to be associated with impaired renal health, whilst vitamin C deficiency causes endothelial dysfunction via increased oxidative stress. Zinc is also vital for renal system function. A 30 mg daily dose of zinc was seen to prevent diabetic nephropathy in human clinical studies. Zinc has also been shown across many clinical trials to effectively reduce the blood glucose biomarker HbA1c. Taurine has also been shown to assist glucometabolism through a variety of mechanisms, including an antioxidant action, osmoregulation, anti-inflammatory action, and supporting glucose homeostasis. Low levels of B vitamins such as thiamine, niacin, and pyridoxine, in conjunction with low levels of ascorbic acid, have been associated with increased insulin resistance, metabolic dysfunction, metabolic syndrome, and diabetes. A recent study of 200 participants found thiamine, niacin, pyridoxine, and ascorbic acid were lower in metabolic syndrome subjects than controls. Methylation is involved in thousands of biochemical reactions in the body and is a vitally important process to maintain optimal health and well-being. A large amount of studies support the notion that impaired methylation contributes to the development of a broad array of diseases across a number of body systems. Folinic acid, B vitamins, zinc, and taurine are all essential to methylation and in the reduction of homocysteine. 3 grams of daily supplementation of taurine has recently been found to reduce homocysteine levels over 4 weeks in a human clinical study. When compared to the serum homocysteine levels at the beginning of the study, the participants' serum homocysteine levels were significantly reduced after taurine supplementation. So if you have patients that present with fatigue, stress or anxiety, nervous system dysfunction, type 2 diabetes mellitus, blood glucose or blood lipid dysregulation, hypertension, cardiovascular disease, or renal system function, combining magnesium, taurine, activated B vitamins and buffered vitamin C may be able to assist. For further information or for information on the clinical trials discussed, please visit www.bioconcepts.com.au.